Hello everyone. Today we are looking at a gold standard assessment in occupational and physical therapy, the 9-hole peg test. It's a quick, simple, and highly effective way to measure unilateral finger dexterity. The equipment. The entire setup consists of a standardized plastic board with a shallow round container on one side holding 9 small pegs and a grid of 9 empty holes on the other side. The pegs, 9 cylinders, roughly 1.3 inches long and 0.25 inches in diameter. The board, a flat surface where the distance from the center of the peg container to the center of the hole grid is exactly 5 inches. The grid, a 3x3 square grid where the holes are spaced exactly 1.25 inches apart from center to center. You also need a reliable stopwatch. The normative data collected over decades, like the averages by age and gender, is calibrated to the exact physical dimensions of the official kit, the precise peg diameter, weight, hole depth, and the distance between the container and the hole grid. In clinical research and standard healthcare practice, validity depends entirely on using the standardized board and pegs. A formal clinical assessment, research reporting, or insurance documentation must use standard equipment. The test is always performed one hand at a time, typically starting with the dominant hand. The board is centered directly in front of the client, with the peg container positioned on the same side as the hand being tested. Once the therapist says go, the client must pick up the pegs one by one. The stopwatch starts the exact moment the client touches the first peg. Place them into the 9 empty holes in any order until they are all filled. And then, without pausing, remove them one by one, returning them all back to the container. The score is time-based, and it stops the instant the final peg is dropped back into the container. The next step would be to perform the test on the opposite hand. For this, turn the board such that the peg container is towards the tested side. The test measures time required to complete the task in seconds. The lesser the time required means a faster performance and better manual dexterity. The time is compared with age, gender, and dominant hand-specific normative values. A change of more than 2 standard deviations is considered clinically significant. According to the decades of research, 3 trends have been noticed. 1. Females score faster than the males. 2. Finger dexterity declines with age after 30. 3. Non-dominant hand scores are 1 to 2 seconds slower than the dominant hand across all age groups. Clinically, a score that deviates by more than 2 standard deviations from the age/gender mean is typically considered as significant. A significant change in seconds over time tells us whether a patient's hand function is improving or deteriorating. The video description mentions the standard mean baselines and standard deviations for the dominant hand. Clinical cutoffs and significance. The 20% rule. When tracking patient recovery, a change of 20% or greater in completion time from the patient's baseline is considered a hallmark for a true, clinically meaningful change in status. The floor effect. For severe impaired who cannot complete the test within standard upper limits, often capped at 50 or 100 seconds. Finally, some common mistakes during the test. Using the non-tested hand to stabilize the board or assist in grabbing pegs. The non-tested hand must remain resting quietly on the table, which can invalidate the results. Another error is trying to pick up or hold multiple pegs at the same time. You must handle one peg at a time. Lastly, if a peg drops off the table entirely, the test should be stopped and restarted, as scrambling for a dropped peg skews the final time and doesn't accurately reflect the true finger dexterity.